Welcome back. Welcome back. I'm Ana Maria Salazar. Thank you so much for joining us. Boy, this has been a long year. It's been, especially, it's been a year where it's almost impossible to try to predict what the next 4 or 5 months are going to look like. And the reason why I say that, it's because in prior years, usually in September, the beginning of September, we'd have a series of interviews on this show to start trying to predict what December or the beginning of the year is going to look like in terms of the economy, in terms of politics. It's very difficult, and it's very difficult to figure out what is the course of this pandemic crisis, especially when you listen to the numbers being provided by the federal government. Especially worrisome this year, this week, was the fact that Amnesty International came out with very worrisome data. Mexico has the highest deaths of healthcare workers that have been working with COVID-19 cases. Mexico, for example, has had about 1,320 deaths compared to, it's higher even than the United States, which has 1,077. England has had 634 34 deaths. So there's something going on in Mexico in which, this data that's being provided by the government they seem to be very optimistic, but the reality, I'm not too sure, is reflecting that optimism. So joining us today, once again, is Dr. Guillermo Torre. He is the president of TecSalud. We had the opportunity to interview him literally during the beginning of this pandemic crisis. He joins us again, and I really appreciate Dr. Torre for you to take our call, to join us today, because I have to admit, I'm somewhat confused. I don't know how to describe to our audience whether the pandemic crisis is the number of cases, whether we're improving or not. Where are we, doctor? Welcome to the show.
Thank you, Ana Maria. It's good to be here with you. I don't know that I would describe the situation today as improving. I think we, as a whole, when you look at the country, there may be a fewer cases, the way our country has followed the number of cases. We look at trends, not a total number, but there may be a lower number. But really what worries me more is as this is happening, there's a strong effort to open more sectors of the economy, which I understand. I'm not necessarily against that, but the experience that other countries have had when they are facing opening of different sectors of the economy has been a resurgence in the number of cases. And I think that's really what worries me more, because yes, if we accept that maybe the number of cases are coming down and we are going to be facing opening more sectors, if we don't have a better strategy, and I think that the first wave, we didn't face it in the best way. I think this second wave may be even more devastating. Now, why do I say that? Because of the fact is that people are tired, people have been suffering the stress. We've faced the fact that we've been one of the countries more affected in terms of mortality in healthcare workers, which creates a very bad morale among the personnel. And I tell you that I see that because I see how people behave, how people are taking care of patients in the healthcare sector. Our hospital has provided care for not only people with insurance, but we've opened our doors to individuals that needed attention and needed care. And many of our doctors work in the government sector, and I see the differences. So if we don't take care of the people that are on the first line, and that's been clearly affected, those individuals have been clearly affected as by the report of Amnesty International, I think that we are going to face a second wave with a much lower capacity of the healthcare sector, with strategies that haven't changed, with the behavior of our communities that may be not conducive for decreasing the transmission of the virus because of the economic need. And I fear that the second wave may be more devastating than the first one, as it has been observed in other countries or in states like in Texas or Florida or Spain today. So we would need to do something drastic to prevent a more devastating second wave.
Now, Doctor, what's your opinion regarding this color-coded strategy to define what is the situation in each state? In Spanish, it's known as semáforo. Is that working? Is that useful?
I don't know, Ana Maria. I think that people have had a very hard time at the local governments to accept what's been predicated at the federal level. And in fact, that strategy may as a whole not be the best strategy. I say you may just give the state autonomy to decide how they want to handle it. Maybe the federal government should provide more assistance, provide more support, but not necessarily dictate what happens at the local level. Because the reality is that local governments should have better information, more rapid information, more accurate information, and they have the resources to make those decisions. So I don't know that a federal mandated strategy is really what's appropriate. Now, why do I say that? Because it has been seen at different state governments that the numbers that the federation has are not always the same as the local governments. And certainly the waves of cases occur at very different levels. And if you have a lag time between the observed cases, what's reported, when signals come from the central government, they may not be correct. And I think that assuming that the states do not have enough capacity or intelligence or the ability to respond, it's probably undermining those individuals that are in the fight against the pandemic, because the federal government is not in the fight. Those individuals that are fighting are those of the local government, is the local hospital, the state health agencies, the private and the public hospitals within the state. So I don't, it's my impression that there probably a better way to handle that, not with a central mandated semáforo.
Right.
I think that I would probably, I don't think that that's going to contribute a lot, to tell you the truth.
One last question, Doctor, because we're literally running out of time. What could the Mexican government be doing at this stage, considering this scenario that you described to us, that there is concern that there's going to be a resurgence of COVID-19 due to the opening and people just moving around the country? I mean, people are trying to return to their normal routines. What could the government do at this stage?
So let me maybe give you three suggestions or ideas that I would provide. Number one is, I think, the government has the responsibility to provide a strong, clear message to the community. And that message has to be of unity. And to make that happen, there has to be a moment in which the leadership in the government unifies the public sector, academic industry, with a purpose to fight the virus and not create division within. I think that will be a strong positive message. Today, we don't have that. I think that will be one. Number two, I think that you need to stop the transmission of the virus, not only with distancing, not only with face masks, which is important, but I think more testing will be appropriate. And we have to accept the fact that more testing with proper tracing would be essential. And if you accept that, I would implement today's strategy to do massive testing. Now, we have not done that either. And number three, I think the use of technology that will provide a strategy to tracing will also contribute to decrease the transmission of the virus. So more clarity in message. I think the leadership has the responsibility to unify, not to divide. I think more testing. And third, proper tracing to prevent the transmission of the virus. And those will be three simple things. maybe lastly, I would create more empathy with the healthcare worker, because I think what we've seen with Amnesty International it's devastating to the community that care for patients. I think that to be more empathic with those will be to protection, PPE, with more communication, with bring those individuals in a forum where they express their opinion and they feel that their demands or their needs are met, I think will be very, very important.
Dr. Guillermo Torre, President of TecSalud, I really appreciate you joining us. Thank you so much.
Thank you, Ana Maria.
Our Twitter account is @Mexico Daily. Please follow us. Let's go to break. I'll be right back.